Did you know that over 50% of people aged 60 and above struggle with insomnia? If you're one of them, you might think sleepless nights are just part of getting older. But here's the thing, insomnia is not something you just have to live with. It can have a major impact on your health, from causing fatigue and irritability to increasing your risk of chronic conditions like heart disease and diabetes. Imagine being exhausted but unable to sleep night after night. This is the harsh reality for many seniors. But don't worry, there's hope. In this article, we'll explore the common causes of insomnia in older adults and, more importantly, provide practical solutions to help you sleep better. By understanding the reasons behind your sleepless nights and taking simple steps, you can regain control of your sleep, wake up refreshed, and feel healthier overall. Let's dive in. Section 1. Understanding insomnia. To tackle insomnia, we first need to understand what it actually is. Insomnia is more than just the occasional sleepless night. It's a persistent condition that can make it hard to fall asleep, stay asleep, or wake up too early, often leaving you feeling exhausted during the day. For people over 60, insomnia can become even more problematic because of the natural changes that occur in our bodies as we age. A. What is insomnia? At its core, insomnia is the inability to get enough sleep, but it can manifest in different ways. Some people struggle to fall asleep at all, lying awake for hours. Others may fall asleep but wake up frequently during the night or too early in the morning, unable to get back to sleep. While it's common to have occasional sleepless nights, insomnia is typically defined as having trouble sleeping at least 3 times a week for a month or more. For many seniors, insomnia often feels like a vicious cycle. The more they try to sleep, the more anxious they become about not sleeping, which only makes it harder to fall asleep. This is where understanding the root cause becomes essential. Because once you know what's behind your sleepless nights, you can begin to take steps to break the cycle. B. Common signs and symptoms in people over 60. The signs of insomnia can be easy to miss or dismiss, especially if you assume it's just part of aging. But if you find yourself feeling exhausted during the day, unable to focus, or struggling to stay alert, these could be symptoms of insomnia. For seniors, the symptoms may also include waking up feeling unrefreshed or having trouble staying asleep through the night. Imagine this. You wake up at 2 a.m. and can't get back to sleep no matter how hard you try. You check the clock, frustrated by the hours ticking away, knowing you'll be tired again tomorrow. It's not just about the sleep you lose at night, it's the impact it has on your day-to-day life. From mood changes to difficulty concentrating, insomnia doesn't just affect your sleep, it can affect your entire quality of life. In the next section, we'll take a closer look at the causes of insomnia, particularly in older adults, and what might be disrupting your sleep. Understanding these causes is the first step towards finding solutions. Section 2. The causes of insomnia in seniors. Understanding what causes insomnia is key to overcoming it. For seniors, the reasons behind sleepless nights are often more complex than just getting older. Several factors, ranging from physical and mental health conditions to lifestyle habits, can interfere with sleep. Let's explore some of the most common causes of insomnia in people over 60. A. Age-related changes. As we age, our sleep patterns naturally change. One of the biggest changes is a shift in the body's internal clock, or circadian rhythm. This internal clock helps regulate when we feel sleepy and when we wake up. But with age, it often becomes less synchronized with the natural day-night cycle. Seniors may experience an earlier bedtime and wake-up time, making it difficult to fall asleep and stay asleep through the night, even though you're still tired. Additionally, as we age, the amount of deep sleep, the most restorative stage, tends to decrease. Seniors often experience lighter sleep, which can be easily disturbed by noise, movement, or even a change in the environment. The result? You might wake up multiple times throughout the night and struggle to get back to sleep even though you're still tired. B. Health conditions. Many health conditions common among older adults can contribute to insomnia. Chronic pain, for instance, is a frequent disruptor of sleep. Conditions like arthritis, back pain, or neuropathy can make it difficult to find a comfortable position to sleep in, leading to restless nights. Other chronic conditions, such as heart disease, diabetes, and respiratory problems like sleep apnea, can also cause sleep disturbances. Sleep apnea, in particular, is common in seniors and involves frequent interruptions in breathing during sleep, often leading to waking up feeling tired even after a full night in bed. Medications used to treat these conditions can also interfere with sleep. Certain drugs, especially those for high blood pressure, depression, and anxiety, may have side effects that disrupt sleep patterns. It's important to talk to your doctor about any medications you're taking and whether they could be contributing to your insomnia. C. Mental health issues. Anxiety, depression, and stress are common among seniors and can significantly affect sleep. Anxiety can lead to racing thoughts at night, making it difficult to fall asleep. Likewise, depression can cause people to either sleep too much or, conversely, experience insomnia due to a lack of restful sleep. The mental toll of dealing with life's challenges, like the loss of loved ones, financial stress, or health concerns, can be exhausting, yet these worries can prevent your mind from shutting down at night. If you find yourself lying awake thinking about everything on your mind, it could be a sign that your mental health is affecting your sleep. D. Lifestyle factors. Your daily habits and routines play a big role in your sleep quality. What you eat, how much physical activity you get, and even your evening routines can either help you fall asleep or keep you awake at night. For instance, caffeine and alcohol are two common culprits that can disrupt sleep. Drinking coffee or tea in the afternoon may keep you alert when you're trying to wind down, while alcohol, although it might make you feel drowsy initially, can disrupt the deeper stages of sleep. Heavy meals close to bedtime can also make it hard for your body to relax and prepare for sleep. Lack of physical activity during the day can also affect how well you sleep. If you're sedentary, your body may not be tired enough to fall into deep sleep. On the other hand, regular light exercise, like a daily walk, can help promote better sleep by increasing the body's need for rest. Finally, technology plays a significant role in modern sleep problems. The blue light emitted by phones, tablets, and computers can interfere with the production of melatonin, the hormone that helps regulate sleep. If you're using screens right before bed, it can make it harder for your body to signal that it's time to wind down. E. Environmental factors. Your bedroom environment plays a major role in how well you sleep. Factors like noise, light, and temperature can all contribute to restless nights. A room that's too hot or too cold, too bright or too noisy can prevent you from reaching the deeper stages of sleep that your body needs to feel rested. For example, if there's street noise outside, or if the room is too bright due to street lights or a television, it can make it difficult to fall asleep or stay asleep through the night. Ensuring that your bedroom is dark, quiet, and at a comfortable temperature can make a significant difference in your sleep quality. Understanding the causes of insomnia in older adults is an important first step toward improving your sleep. While some of these factors are outside of your control, many are manageable with simple lifestyle changes or professional help.
In the next section, we'll explore how insomnia affects your health and the steps you can take to regain control of your sleep.
Section 3. How insomnia affects your health. The impact of insomnia goes far beyond just feeling tired during the day. For seniors, the consequences of poor sleep can have serious implications for both mental and physical health. Chronic sleep deprivation can affect mood, cognitive function, and overall quality of life, increasing the risk of developing a range of health issues. A. Short-term effects. In the short term, insomnia can leave you feeling fatigued and irritable. This isn't just about being tired, it's about the mental and physical toll that sleeplessness takes on your body. The frustration of not being able to sleep can lead to anxiety, making it even harder to fall asleep the next night. As a result, you may start to feel less focused and more forgetful, and even the simplest daily tasks can feel overwhelming. Daytime sleepiness in particular can affect your ability to concentrate, driving, and even performing household chores. This could lead to a decrease in your overall productivity and a sense of frustration. And for many seniors, sleep deprivation can also lead to mood swings or increased irritability, which can affect relationships with family and friends. Imagine feeling constantly exhausted, but not being able to get the rest you need to recharge. It's a cycle that can quickly spiral into other issues if not addressed. However, the effects of insomnia aren't just limited to the short term. Over time, chronic insomnia can have much more serious consequences. Sleep plays a crucial role in maintaining overall health, and without enough quality sleep, your body becomes more vulnerable to a variety of conditions. One of the most significant risks associated with long-term sleep deprivation is the increased likelihood of developing chronic health issues. For example, sleep deprivation has been linked to an increased risk of heart disease, high blood pressure, and diabetes. Without enough sleep, the body struggles to repair itself, leading to inflammation and stress on the cardiovascular system. Studies have shown that people who consistently get poor sleep are more likely to develop these conditions over time. Additionally, insomnia can have a negative impact on brain function. Chronic lack of sleep has been shown to impair memory, learning, and decision-making, making it harder to think clearly and remember important details. For seniors, this is especially concerning because cognitive decline and memory problems are already a concern as we age. Insomnia can exacerbate these issues, potentially increasing the risk of dementia or Alzheimer's disease. Perhaps the most alarming consequence of long-term insomnia is its impact on mental health. Chronic sleep deprivation is a major risk factor for depression and anxiety. Seniors already face challenges related to loneliness, loss, and significant life changes, which can contribute to mental health struggles. When combined with poor sleep, these factors can make mental health issues much worse. In summary, insomnia isn't just an inconvenience. It's a serious issue that affects both your physical and mental health. If left untreated, it can lead to a host of long-term health problems, making it crucial to take action. The good news is once you understand the causes and effects of insomnia, you can begin to take the steps necessary to improve your sleep and in turn, improve your overall health. In the next section, we'll explore practical solutions for overcoming insomnia and achieving better, more restful sleep. From lifestyle changes to medical treatments, there are a variety of approaches that can help you get the rest you need. Section 4. Solutions. How to overcome insomnia. While insomnia can be a frustrating and persistent issue, there are many effective ways to overcome it. Whether the cause is physical, mental, or environmental, addressing insomnia involves making a series of changes that promote better sleep. Fortunately, many of these solutions are simple and can be incorporated into your daily routine. Let's look at some practical strategies to help you get the rest you need. A. Natural sleep aids. For many people, turning to natural sleep aids can be a helpful first step in improving sleep quality. Herbal remedies like chamomile tea, valerian root, and melatonin have been used for centuries to promote relaxation and improve sleep. Chamomile tea, for instance, is known for its calming properties and can be a soothing way to wind down before bed.
Melatonin, a hormone naturally produced by the body, helps regulate the sleep-wake cycle. As we age, the production of melatonin decreases, making it harder to fall asleep. Taking melatonin supplements before bed may help restore some balance to your body's sleep cycle and improve sleep quality. However, it's important to consult your doctor before using any natural sleep aids, especially if you're already taking other medications, to ensure there are no interactions or adverse effects. B. Lifestyle changes. One of the most effective ways to improve sleep is by establishing a regular sleep routine. Going to bed and waking up at the same time every day, yes, even on weekends, helps regulate your body's internal clock and makes it easier to fall asleep and wake up. A consistent schedule signals to your brain when it's time to sleep, making the process more natural. Creating a relaxing pre-bedtime routine is also crucial. Consider activities that help you unwind, such as reading a book, listening to calming music, or practicing relaxation techniques like deep breathing or progressive muscle relaxation. Avoid activities that are mentally stimulating, such as watching action-packed TV shows or checking your phone, which can keep your mind alert. C. Diet and nutrition. Your diet can have a significant impact on your ability to sleep well. Certain foods promote relaxation and improve sleep quality, while others, such as caffeine and heavy meals, can interfere with sleep. For example, try to avoid caffeine found in coffee, tea, and some sodas in the afternoon or evening. Caffeine is a stimulant that can stay in your system for hours, making it difficult to fall asleep. Similarly, alcohol, though it may initially make you feel drowsy, can disrupt sleep cycles and prevent deep, restorative sleep. Instead, focus on foods that promote relaxation, such as bananas, almonds, or a small bowl of oatmeal. These foods are rich in magnesium, tryptophan, and other nutrients that support better sleep. A light snack before bed can also help stabilize blood sugar levels, preventing disruptions in sleep.
D. Exercise and movement. Regular physical activity can have a profound impact on the quality of your sleep. Exercise helps regulate your body's sleep-wake cycle and reduces stress, both of which make it easier to fall asleep at night. However, it's important to time your workouts carefully. While daytime exercise can promote better sleep, vigorous exercise close to bedtime can have the opposite effect and keep you awake. Aim for light exercise during the day, such as a walk, gardening, or stretching. Even a short walk after dinner can help your body relax and prepare for sleep. E. Creating the right sleep environment. The environment in which you sleep can significantly influence your ability to rest. Creating a bedroom that promotes sleep is key to improving your quality of sleep. Make sure your bedroom is quiet, dark, and cool. Use blackout curtains to block out any light from outside, and consider using earplugs or a white noise machine to mask distracting sounds. The ideal sleep temperature is between 60 and 67 degrees Fahrenheit, or 15 to 19 degrees Celsius. A room that's too hot or too cold can disrupt your sleep, so make adjustments as needed to keep the room comfortable. Also, consider investing in a good quality mattress and pillows. As we age, our bodies become more sensitive to discomfort, and a supportive mattress can make a world of difference in how well you sleep. F. Cognitive Behavioral Therapy, CBT. Cognitive Behavioral Therapy for Insomnia, CBTI, is a highly effective treatment that helps address the root causes of insomnia. Unlike medication, which may only mask the symptoms, CBTI focuses on changing negative thought patterns and behaviors that contribute to sleep problems. This therapy teaches strategies to manage anxiety around sleep, set up a consistent sleep schedule, and modify behaviors that may be hindering your ability to sleep. Many people who undergo CBTI find significant improvements in their sleep without the need for long-term medication. If you've struggled with insomnia for months or years, CBTI could be a game changer.
It's worth discussing this option with your healthcare provider, as many therapists now specialize in CBTI for insomnia. G. When to seek professional help. While many people can improve their sleep with lifestyle changes and natural remedies, sometimes insomnia requires professional intervention. If you've tried different strategies and still find yourself unable to sleep, it may be time to consult a doctor. A sleep study, polysomnogram, can help diagnose underlying sleep disorders such as sleep apnea, restless leg syndrome, or periodic limb movement disorder. In some cases, doctors may recommend medication for short-term relief or suggest other interventions tailored to your specific situation. Don't hesitate to seek help if you feel that insomnia is affecting your health and daily life. A good night's sleep is crucial for your overall well-being, and there are healthcare professionals who can guide you toward a solution. In the next section, we'll summarize the key points and discuss how you can take the first steps toward better sleep tonight. Before we conclude, I'd love to hear from you. Before you go, leave a comment below sharing any symptoms or specific concerns you have regarding your sleep or any other health issues you might be dealing with. I will reply to your comments personally or even address them in the next video so that everyone can learn how to handle these challenges. I'm here to help you achieve better health and happiness for you and your loved ones. Don't forget to like this video and share it with your friends and family so they can benefit from this important knowledge too.
Section 5. Conclusion and Final Tips. In conclusion, overcoming insomnia is not just about getting more sleep. It's about improving your overall quality of life. From understanding the causes to implementing practical solutions, the journey to better sleep requires patience, but the benefits are worth it. Remember, while insomnia can stem from a variety of factors like aging, health conditions, mental health, and lifestyle habits, it's possible to find relief through small, intentional changes. Establishing a regular sleep routine, creating a peaceful environment, managing stress, and making mindful choices about diet and exercise are all crucial steps toward improving your sleep quality. Natural sleep aids and cognitive behavioral therapy can be helpful tools, but always consult with your healthcare provider before making any significant changes, especially if you're on medication or dealing with chronic conditions. Getting a good night's sleep can have a profound impact on your mental, physical, and emotional well-being. By taking charge of your sleep habits, you'll not only feel more rested, but also improve your health, energy, and mood.